Hey, it's Dr. Dunaway coming at you with the second part of a three-part series of the Foundations of Recovering Post-Pregnancy. Now, this is going to be talking about internal hip rotation, which is vitally important to sparing the sacroiliac joint and low back from excess motion. We already have some laxity in the ligaments post-pregnancy, so if we can get motion specifically in the hips, it'll take a lot of tension away from the low back. So this is going to be done by sitting with your feet wide, kind of like you would be in a sumo deadlift or a wide squat. Feet are going to be pointing kind of in 25 degree angles kind of away from you here, so not straight ahead. And then what we're going to do is prop ourselves up nice and tall and slowly let one hip fall into internal rotation and then come back out. And as we're going to do that on side to side. And as you can tell, when I move my left leg, my right leg stays still. When I remove my right leg, my left leg stays still. Now also what you'll see is that as I let my hip fall in, my butt doesn't come off the ground and I don't rotate from the lumbar spine. This is what happens a lot of times with hip mobility, is that it looks like we're getting hip mobility, but really what we're doing is rotating from the pelvis and the lumbar spine, and that's what gives you the illusion of internal rotation of the hip. I want you to specifically get that internal rotation, so stay nice and tall. Don't move from the spine, but just move from the hip, nice and easy. Now we can also do that with extension. So hip extension drill is just here. Think about your water, or think about your pelvis as a bucket of water. Tilt water out the back and then lean forward a little bit. But to get internal rotation with this, all we're going to do is slide our leg a little bit out to the side. So this is right behind my knee, internal rotation right here, dump the pelvis back, lean forward. It's the same kind of stretch. So from the side, we're here, foot out, dump the pelvis back, lean forward a little bit, and I get a good stretch on that hip. Don't stretch too much, just stretch a mild to moderate stretch, expand the comfort zone, move slowly, and slowly increase this range of motion in the hips, and your low back will thank you for it. And then when you start to get into more mobility and strengthening drills as you recover, you'll have a lot less likelihood of straining that low back or that sacroiliac joint. So again, this is Dr. Dunaway with Chiro Strength saying don't just mend, transcend.